Good evening, everyone, and welcome to our ninth and final echo session of our Enhancing Palliative Care series. It's great to have you all with us. This session this evening will focus on ageing, aged care and end of life, evidence and resources, and will be presented by Dr Russell Shute and Olivia. So my name is Leanne. I'll be co-facilitating tonight's echo session with Russell. I'm the General Manager and Shared Care Programs Manager here at GP Partners Australia. So before we get underway, I'd just like to acknowledge country. So we acknowledge the Kaurna peoples, who are the traditional custodians of the Adelaide region. We pay tribute to their physical and spiritual connections to land, waters and community, enduring now as it has been throughout time. We pay respect to them, their culture and to elders past and present. We would also like to acknowledge and pay respects to those Aboriginal and Torres Strait Islander people from other nations who live, work, travel and contribute on Kaurna country. So welcome everyone. As I've mentioned, tonight's didactic presentation will be Ageing, Palliative Care and End of Life, Evidence and Resources. As always, just a thank you. This project is supported by funding from SA Health through the Palliative Care 2022 grant program and has been delivered to you by GP Partners Australia. As our last session is tonight, we're hoping that this may be something that SA Health will look to extend and we can offer an echo series again. So just some welcome reminders that we say at each of our echo sessions. Please introduce yourself in the chat. Let us know where you're joining from and your role. Your microphones are muted. There will be lots of time during the session for questions and discussion. You are welcome to use the chat function to ask your questions if you have any comments or are having any technical difficulties, but also feel free to raise your hand. The didactic session will be recorded and will be emailed to you within the coming weeks, and then will be made available by the Palliative Echo website and part of GP Partners website. Remember not to disclose any personal health information during the session, and as always, we hope that you enjoy the session. The general format of an echo session is that we have our introductions, as we're having now, followed by the didactic presentation, and then our interactive case-based presentation and discussion to follow. We do have a case if we have time tonight, and I know Donna hasn't joined us tonight, but we'll probably listen to this later. She has been a great contributor to cases throughout our echo session, so I'd like to acknowledge and thank her for that, and just make another mention that our recordings are all part of our website, so don't forget to go to the websites to have a look at that. So now I'd just like to, as we do, go around the table so that our team can introduce themselves. So I'll start with you, Atif.
Hi, my name is Atif and I'll be providing IT support for tonight.
Hi everyone, my name is Naomi. I'm the Echo Coordinator and website manager.
My name's Julian. I'm a aged care and palliative care pharmacist.
I'm Russell, GP advisor to the program.
And hi, I'm Olivia, palliative care consultant with the Central Adelaide Palliative Care team.
Excellent. So now I will just hand over to Russell, who will present tonight's didactic presentation. So thanks, Russell.
Okay, so tonight is really about providing some useful resources out there. Now, I apologise if people already know about these resources. We're going to go through the way that resources are made available through Department of Health funding, and I think if you don't know about this, there are an amazing number of resources, most to the point of being overwhelming. So hopefully we can make some sense of it.
Oh, Jess, I was watching something.
That's all right, dear. It's okay.
Oh, you're going to be.
Okay, so off we go. All right, there's a picture of lots of young people sitting around in a very groovy open space learning environment. But anyway, I'm not quite sure. So that's what we're going to be talking about tonight. And no surprise to anybody, we live in an aging population. Advances in healthcare have meant that more people are living to an older age, and often that means into the 80s and 90s. And this is producing challenges for our entire health system. And obviously, it's changing what happens too at the end of life. So there are lots of supports out there for people to use, and we're going to go through some of them. So Care Search, and if you just Google Care Search, that is an enormous amount of information that's available through Care Search. Palliative. So a lot of this is being driven from the centre at Flinders University, and they just do. It is an amazing amount of information if you've never looked at it before. And as I said, sometimes a little bit overwhelming, but we're going to go through some of that today. The Silver Book for GPs, probably fairly used to dealing with the Silver Book, the FRACGP Silver Book for caring for people in aged care facilities. And so, yes, we are living longer. So there's on the left-hand side, back at the end of the 19th century, you were doing pretty well if you got to 45. Obviously, things have changed significantly, and progressively through the 20th century, life expectancy increased, and now it's not unusual for GPs to have a reasonably large cohort of octogenarians and nonagenarians, and even centenarians. So, and not surprising, we were laughing about this before with Leanne. So I suppose if we are living longer, we're going to be dying older. But I think what's happening too is that people with cancer diagnoses, even at a younger age, are living longer with their diseases because of changes with immunotherapy, chemotherapy regimes. So more people are making it into their 80s and 90s. So now let me have a look at this one, Leanne. I've got to remind myself of this. All right, so this is a breakdown of the sort of the types of diseases responsible for deaths, and coronary heart disease is still a biggie, and I think we're much better at managing that with cardiovascular medications, especially things like statins, ACE inhibitors, those kind of things. And so people are living longer with their heart disease, but it's still the number one. And of course, dementia and Alzheimer's disease is now taking up a bigger piece of the pie. And of course, that influences the provision of end-of-life care. And maybe after this finishes, Julian might reflect, somebody who works in aged care all the time, about caring for somebody with dementia. Yeah. Despite people's expressed wish to die in the home, certainly this has been the case in the last 20 or so years, most, a large number of deaths still occur in the hospital environment, and many deaths also occur in aged care facilities. So the palliative care services plan in South Australia so there've been a couple since I've been working in palliative care. One of the main aims was really hoping to provide more community care and help people to die at home if that is their wish. And I think, we certainly palliative care services aim their very best to try and make that happen, but it doesn't always happen. So I guess as we do get older, it's trying to provide different options for people depending on what they want and making sure that we can provide those services. Now, in South Australia, and this is a little bit about our multicultural population. And of course, this has changed too since the early part of the 20th century, where it would have been heavily based in Anglo-Saxon people and obviously a percentage of Aboriginal and Torres Strait Islander. Then things changed following World War II with lots of migration and another wave in the 70s from Southeast Asia, and yet another wave from African countries. So there are a lot of people that come from other countries and have different cultural backgrounds and different attitudes to death and dying. It's something that's very important. In the community, well, these are the complexities, I suppose, of providing person-centered care and making sure that there is a group of providers of care working all together to ensure that the person is able to get the care that they want in a culturally and societally sensitive sort of way. Now, here we go. Sorry, I'm having a bit of fun with that. Okay, so these resources we'll be talking a little bit about in coming slides. So all these resources are available to you. Some of this is about recognising the last 12 months. We've talked before in previous Echo sessions about the SPICT tool, and I think we've got that on the website. And it's really, you know, trying to identify as a GP whether your patient is approaching the last 12 months of their life, and asking yourself the question, would you be surprised if they died within the next year based on their age and comorbidities, whether they've been having, you know, increasing hospitalizations, talking to their family, and using that as a trigger then to start planning care. So we'll go through some of those things in a minute, but once you have identified that somebody's likely to die, or at least you wouldn't be surprised if they were going to die within 12 months, it's then starting to put some of the things in place, and advanced care directives, talking to the family about how things might need to be done to support somebody if they want to die at home, maybe dealing with specialist services like palliative care, and importantly, through this process, taking care of yourself. One of the other things, I suppose, is we had that very good talk with Chris Moy about voluntary assisted dying, which formally started at the end of January in South Australia. And that's another aspect now, depending on whether people fulfill the criteria. It's another possibility that could be coming into play with end-of-life care. So there is a slide about that as well, but I would recommend you have a look at Chris's really good talk. That was a few months ago. Now, here's a bit of an overwhelming slide, but these are all the different things that government are supporting to try and help make sure that care for people who are approaching the end of life is as good as it possibly can be. So from the left, and we'll talk about these things in the coming slides, Palliaged is a very good website, also a very good app that GPs can use. So the end-of-life dying aged care, LDAC, we'll talk a little bit about that, PHNs, dementia case conferencing, and then more specific support for patients and their families around, so things like carer help, caring at home. So there are an enormous number of resources that if you haven't been aware of them, we're going to talk a little bit about in the coming slides. So Care Search, the first one to talk about, has got an enormous amount of information, including some of the specific stuff around MBS items that can be used specifically when you're doing case conferencing and other things, because I think it's tricky when you're managing a palliative care patient in the community. I don't think necessarily GPs have been particularly well remunerated for that, and there are ways of maximising your return for actually what is a very involved job. So but there is a lot of information on Care Search. If you haven't looked at it before, there's up-to-date research. So I would recommend you have a look at that one. And there is a lot of information you can see there. So you can really dig down into Care Search. Care Search could keep you busy on a rainy day. If you've got nothing else to do, I would recommend you have a look at Care Search. Because it is a many-layered website with all sorts of information for people. Palliaged, I certainly use the Palliaged app, and that's so yeah. If you just go into the App Store and just put in Palliaged, you should find it. Really nice, simple interface. If you're looking after people in aged care, really helps provide some simple advice about identifying the terminal phase and the sort of medications and other things we've talked about before that you might want to make available in an aged care setting. So yeah, specifically for aged care, but very useful. The Advanced project is about advanced care planning. They also have lots of modules, and I've been to face-to-face workshops with them as well. I don't know whether they still, I'm presuming they still provide them. And it's, keep an eye out for that. But again, so Hammond Care is a very good organisation that provides aged care in Australia, and most of the Hammond Care resources I found very useful. There's a little bit more about ACP. And just remember that, these slides are going to be available for you to come back and have a look at if you forget what I'm talking about all these things, because there is a lot to look at. Carer help, obviously, carer burnout is very common. And one of the most important things we can do to ensure that somebody is able to fulfill the wish of dying at home, if at all possible, is to care for the carer. And so this website provides some information and support if you're providing care, as we often have as GPs, for both partners in a relationship. Helping the carers out is very, very, very important. And there's a little bit more about caring safely at home. And there's a comment about NPS medicine-wise, which makes me very sad because they don't exist anymore. I can't believe that NPS don't exist anymore, but anyway, there will be. Julian, have you heard what's going on to fill the void?
No, there's like a tender, I think, at the moment.
Okay,
so that replacement.
Yeah, so I guess as GPs, and if you've been around general practice as long as I have, always found NPS a really fantastic resource. So that's a great loss. But some of these resources have been developed by NPS. So you'll see there is a bit of overlap between some of these resources inevitably, but that's a good thing. So LDAC has got a particularly good primary care toolkit, worth having a look at that. There's also some legal advice, and I'll talk about more specifically about legal information in a subsequent slide. So I guess ultimately what we're talking about is there's lots of stuff out there, and so do not feel like you're lost and alone. Now, the top right of that screen grab, the LDAC helpline, that's staffed during business hours, but always worth a ring if you're really stuck. In aged care, Julian, I don't know if you ever rung LDAC before?
No, actually,
Okay.
I haven't rung them. I've used their website a lot.
Yeah, yeah.
Never had to call
Websites,
them.
it's pretty easy to navigate.
Yeah.
And here's some more screen grabs of all that. Pepper. The Pepper project has been around for quite a long time and enables health professionals to directly experience palliative care services, and they, I believe, actually it's funded so that, for instance, if you're a GP, you can spend some time with the specialist palliative care service for a few days and you'll get paid for your time. But it extends beyond that. So, you know, nurses, pharmacists, social workers, whatever. And certainly when I was with Central Adelaide Palliative Care, we had lots of pepper people, as we would call them. So that's a useful thing. If you wanted to be a fantastically useful way to experience, you know, the day-to-day workings of a specialist palliative care unit and how they go about their business and really learning from the experts, and all the details are there as well. So the Silver Book is easy to find online for FRACGP. I don't even think you need to be a member to access the Silver Book. I think you can just find it. So that's got palliative care specific information, but obviously it's much broader than that, and lots of useful principles for those of us who see lots of older people in our practice. But again, I'm probably telling you how to suck eggs, telling you about the Silver Book, because it's been around for quite a long time, and I think it's a fairly important resource for GPs. This one is something that I've used quite a bit, especially if you're particularly interested in the law and how it relates to decision making around end of life. This is a Queensland based group of lawyers that research specifically around this area. It's got multiple modules that you can do, and I'm sure you could use them towards the new CPD. And I found that really interesting because, of course, they've had to adapt to all the changing legislation around voluntary assisted dying. So it's a very, very useful thing. It's an easy thing. You just register with a username and password, and then there's multiple different modules to do, but I would recommend that to anybody. Voluntary assisted dying I touched on earlier, and we had Chris Moy doing a whole session about that. Important to know about because you know, it started at the end of January. There have been several South Australians that have now accessed voluntary assisted dying, both in their homes and, of course, if anybody's in a residential aged care facility, that is considered the same as a home. And so even though there are exceptions made for private hospitals that are run by specific organisations, e.g. Catholic health organisations who've got a conscientious objection to it, that doesn't cover people in residential aged care facilities, so that if they're in a Catholic residential aged care facility, the law states that they must be allowed access to voluntary assisted dying. So I think there's a fair bit happening. Now, if you just Google voluntary assisted dying SA Health, there are some very, very useful resources there. It's well worth doing, and I've recently done the voluntary assisted dying training. I think if you've got the time to do it, just helping people understand exactly what's involved, I found it very useful, because I think, you know, we are going to confront this more day to day. We're going to have patients that are going to ask us about it, and it's going to be happening. So have a look online and yeah, consider doing the training if you've got the time for that. obviously we've been lucky enough with the ECHO project to have Olivia join us, and she works with Central Adelaide Palliative Care Services. But for anyone in South Australia, there are 3 major specialist palliative care services: Northern, Central and Southern. And they all have different responsibilities for different regional and rural areas of South Australia as well. Next slide will show their contact numbers, but never feel that you're doing any of this by yourself. There are always people to talk to, and that includes after hours. So usually a registrar or consultant traditionally will answer the phone if you need help, if you're stuck and you're not too sure what to do, whether it's a question about medication management, or whether it's a question about managing culturally, linguistically diverse situation or existential distress, whatever. If you feel like you are at the limit of your expertise or capacities, then please ring for help. Phone a friend, as they say, and there's all the contact numbers. So palliative care referrals, my understanding is most GP software will include this in there. These days we'll have these loaded, and it takes you through the process if you want to refer to people. I'm assuming I'm preaching to the converted here, but there's individual numbers also for people that live in regional rural areas as well. So I've just talked about there are lots of resources out there. I would say if Care Search has got an enormous amount of stuff, and if you Care Search, Palliaged and LDAC, if you just held them, you've got so much information that you kind of won't know what to do with it, but they are easy to navigate. And there are specific areas for GPs. And again, the sections for GPs are also easy to navigate with drop-down boxes and specific information about symptom management, etc., etc. So the Department of Health funds, quite an extensive national palliative care program, and it realises that we are dealing with an ageing population, and that produces challenges. There are lots and lots of tools out there, and I think this is a very good point, Leanne. No matter where you start, you'll find it. I think I've just said the 3 main ones that I use. It doesn't really matter where you start, you'll probably get the answer you want. Now, maybe you would like to ask this question, Leanne.
Well, I can ask you.
You can ask me.
Okay, Russell, that's a good idea. So resources are available as you've described, and we've heard a lot about them, but how do we share them effectively? How does we get that out apart from through our project ECHO?
Yeah, it's like projects like this. It's like projects that the last project we had, which is GP Shared Care. It is ongoing education of GPs through various organisations. So I know now that CPD has changed, there are some big medical education organisations that are producing resources around this. And I think it's working. It's having people that are interested in the same kind of thing and being prepared to talk to each other. And so I think that's probably one of the things that GP Partners has done very well. But also I would say, don't be a stranger. If you're really interested in palliative care and providing palliative care, talk to your local specialist palliative care service. I don't know, back in the day, we used to have this palliative care special interest group, and a group of GPs would meet once a month. I don't think this happens anymore. Olivia may know the answer to that. But we would meet once a month. Michael Briffer organised that at Calvary. I think it may have gone, headed to heaven. But things like that are really good. And I think getting online in Facebook-based groups, GPs Down Under, those kind of things. I think that's how we share. We talk amongst ourselves locally in clinics, and that's the way people share information, really.
Right, and I guess the question then is what would make these resources more useful?
So I know Olivia's going to talk about some other resources in a minute, and they're really good. They're really practical and simple. It's all about simplicity of use, because we often haven't got a lot of time, and we're making decisions sometimes in stressful situations, and so either out in the community or in a nursing home. So it's making sure that there's a good interface. So I do like Palliative because I think it's pretty simple. It's pretty easy to use. There are, and I think Olivia's going to talk about opioid conversion resources. There's a couple of others. So it's all about simplicity, practicality that GPs love. Keep it simple, stupid. We like simple things, really. But I do think what we've gone through tonight is so many resources that the one problem is getting overwhelmed. But I think it is easy to navigate, and you will almost always find what you're looking for.
And I think a lot of these resources or organisations that are very effective in producing these resources have subscriptions that you can actually, like Care Search, they will send you like a monthly newsletter or a weekly.
No, that's true.
That comes out with topics of choice. So I guess keeping up with what that
yes, absolutely.
saying is a good way too.
I think also one way to combat that like massive glut of resources, because we had a very similar issue at the Southern Palliative Care Unit. We had something like 200 different resources floating around in our system, and it was just too overwhelming.
Yeah.
So we kind of like cut them down, collated them, and then saved hard copies or like soft copies on our network drive so that they were accessible, and the doctors knew where they were, they knew what they were kind of the ones that they were familiar with. So going through a process like that, I think could help, like have those documents ready, know what they are.
Or even having them in the practice.
Exactly.
They can be.
And I imagine even reaching out to some of those sources like the palliative care teams. I'm sure they'd be happy to share some of those, like even the internally made ones. I don't know if they'd be too upset. So. I don't know, maybe speaking for you, Olivia, but I'm sure they'd be happy to share some of those odd things, like like the morphine flyers and that kind of thing, because a lot of that's not really publicly available easily.
I'm just looking at and I think there was a little note about it, but there's another one that I use called Palli Meds, which is still available because NPS helped develop that. So
you've got to be careful. There's two, and one doesn't work. Yeah, that's happened to me.
So PALLIMEDS, but for whatever reason, mine still works.
Yeah, no, they're both spelled exactly the same.
And it's got, I think so. That's a bit more pharmaceutically sort of focused, but it's that's a good one as well. So yeah, that's the answer. But I think clearly they have spent the unit, the team of researchers at Flinders, they have spent an enormous amount of time and effort, and they're pretty useful, really nice.
Julian, you mentioned ARIA earlier. Are they a newer organisation that's doing work in the palliative space, or?
No, not specific palliative. So ARIA are they're a research institute that are looking at using technology and advanced and making things like practical and sort of streamlined. So they provide grants every year or two. So I'm working with some researchers at UniSA who won one of those grants. But those grants are kind of designed at using mainly technology to improve things like healthcare.
And that may be something where palliative resources.
Yeah, I think there's a lot of at the moment talk about
age,
making things apps, putting things online, making things accessible through clouds and stuff. So I think that will be the future at some point. Maybe some sort of AI, ChatGPT will get involved.
Controversial. So what I might do is hand over, because it's a perfect segue to Olivia, really, isn't it? Because she's got some. Is that okay, Olivia? You happy to I will stop sharing my screen if you're happy to talk about your resources.
I've really just put together the ones that I feel are the ones that I reach for on my day-to-day in my day-to-day work. And certainly there is a huge volume of information, and something like Care Search I actually find a bit overwhelming, and I find the platform a little bit difficult to navigate as well. So I've just sort of tried to trim it down to the ones that I really like. I think in terms of symptom management, if you need a sort of a quick refresher on how am I going to manage somebody's, bowel obstruction or nausea, there is a wonderful app called Pocketbook of Palliative Medicine. It's got a little sunrise on its icon. I'm quite sure it's a free app. I don't remember purchasing it. And it has been written by a palliative care physician who trained in SA but now works in Queensland. Graham, yeah. And it's actually wonderful. It's so accessible on your phone. The platform's wonderful, and you just get quick information really quickly. And so I think that that's a wonderful one for people who are quite time poor, or sort of trying to quickly make decisions. And it's something that I often refer to as well. I think, Russell, you mentioned the Scottish Palliative Care Guidelines, but I find that there aren't a lot of guidelines available, but the Scottish ones are really excellent, and also ones that I refer to quite a lot. It feels a little bit like the time of buying books has passed, but I think the Oxford Handbook of Palliative Care is actually a really good resource as well. And if you were to buy a book around palliative care, I think that that's a pretty safe bet. And I'm very privileged. I have very easy access to the ETG, but I think that they have really good guidelines as well. I think we've talked about it before, Russell, I think you mentioned it, but if we're just thinking about, end-of-life care medications, I've provided a link, but you can just Google SA Health end-of-life care medications, and this guideline pops up. So if you're struggling to remember what drugs somebody might need in their terminal phase of their life, this just provides a nice, neat table, and I actually have it saved on my phone as well. And Safer Care Victoria, they've got a few good resources as well. I'm a little bit upset that they changed their formatting. I don't think it's as easy to look, but there is a resource about which medications can go together in a syringe driver, and which ones are compatible, which is something that if you just need to check, thinking, oh, have I got the right mix of things together, or can all these medications go together? Firstly, I would just say phone a friend, speak to your local palliative care service, but if you did want to have a reference for that, I think this one's probably one of the better ones I've seen. And Julian, you might have a better sense of other resources, but that's quite an easy one that you can find online. We talk about medications, and opioids are obviously a big sort of one of the biggest areas of medication difficulty that we run into. The Society or the College of Anaesthetists have a really great app, the ANSCA opioid app, which can help with dose conversions. The EviQ platform, which is a platform created. I'm actually not sure who's written it. Julian, you might be able to help me out, but it's about.
It's huge. Yeah.
It's a resource around oncology. But they also have quite a good opioid converting tool as well. Safe for Care Victoria, again, they have a wonderful conversion table, and I think that their resource helped me learn opioid conversions. And I quite liked having a sort of a paper-based table that I could refer to. And also, I think, Russell, you said the Pallimeds app is also one. And I actually think I saw that they updated it this year. So it's good to know that that's still, I guess, being maintained.
Good.
Yeah. And Julian, I know you did a wonderful talk about medications and deprescribing, but there's a good SA Health guideline around deprescribing medications, and the Tasmania PHN have also got some deprescribing guides as well, and possibly, Julian, you've got a few other resources.
I think
Sorry?
they're the two I used in my talk, so I think they're
Okay.
yeah.
I think I've subconsciously taken that in and learnt it. And then just a few others. So if you really need a deep dive into medications, I think there is a book called the Palliative Care Formulae. I think they've updated it and they might be up to number 8 now. There's also a resource created, I think, by the Tasmanian PHN as well. They've created a formula, I can't say the word, a formulary around specific medications that we use commonly in palliative care. So I think that they've just focused on 90 specific medications, which is great. Care Search I won't go into again. But EviQ, I think I actually use EviQ a lot. And the way I quite like it is if I'm seeing a patient, I might just look up their chemo regime, and it simplifies, I think it demystifies things a little bit around people who have these really complicated chemo regimes. And what I really like is that it will list side effects to the chemotherapy regimes they might be on, and side effects that might be immediate, short-term and long-term, and the things that you might see more commonly with chemotherapy, but it might not necessarily be obvious. Things like your arthralgias or hand-foot syndrome or neuropathies. You can have a look at that website and say, oh, okay, this is actually quite expected with your regime that you're on. And it sort of provides a little bit of a framework of management as well, which is fantastic. And I won't go over it again, but there's great resource around advanced care directives and also about voluntary assisted dying. And I won't say much about that, but other than I think that the sort of the request for that can be a little bit confronting sometimes, but it's something that can be quite sort of quickly facilitated and handed over to the liaison team. And you can choose to be involved or not choose to be involved. But it's a good streamlined service. You just need that contact number, pass on the patient's details, and they'll take over the process from there. So I think it's good to know how to find that number and that resource, and that's all on the SA Health website. And that's the sort of the core bunch of resources that I use in my work.
Very helpful. Thank you, Olivia.
Yeah.
Good. Now, are there any questions from the possibly only? Oh no, there's a couple of people. Any questions? You can pop them in chat if you want to. So thank you everybody for joining. I will hand back to Leanne, but on a personal viewpoint, it's been great working with you guys. Thank you for your input to Project Echo and the last, how many? 9 sessions.
9 sessions we've had. So I'd like to take this opportunity as well to thank you all for joining us online, and for those that then follow up and listen to our recordings and visit our website, host our echo sessions, and indeed those that have been with us throughout the series. It's been great. I know that we've certainly enjoyed putting this together as a first off and delivering it to you. So in the spirit of continuous improvement, we'd love to get your feedback on how you felt the sessions went. So I will be sending out a feedback survey for you to complete, and would really appreciate that you fill that in and send that back. And as we've mentioned at the beginning of our sessions, indeed each of our sessions, a recording of this session's presentation will be emailed to you and be made available on the website, as we've mentioned. So in closing, we hope that we see you all again, and we hope that we can source some ongoing funding for Project Echo, particularly in the palliative arena, to continue. And I would just like to mention here, before we say goodnight, a huge thank you to the core panel here at GP Partners who have supported the project from the get-go. Really thank you, each and every one of you, for Atif, Naomi, Julian, Andrew, Olivia, and of course Russell, who have contributed a lot of valuable work. It's been greatly appreciated. So in closing, again, please don't forget to access the website and look at the accumulation of resources for the series of Echo. And good night, and thank you for joining us.
See you, folks.
Bye.